Never do this after sex if you're over 60, because what seems harmless could actually be causing cumulative damage you won't notice until it's significant. There's a natural way some men are using to protect against this specific issue. I'll explain what that involves toward the end. But first, let me tell you exactly what you should avoid and why it matters more after 60 than it did when you were younger. Let me walk you through this carefully. Number 1, going to sleep immediately without cleanup. After 60, prostate fluid and seminal fluid can harbor more bacteria than in younger years. Prostate tissue that's even slightly enlarged creates small pockets where fluid can pool. Going straight to sleep without basic cleanup allows bacterial growth in an area that's already more vulnerable to inflammation. This isn't about hygiene in general. It's specifically about the prostate's increased susceptibility to infection after 60. Number 2, drinking alcohol within 2 hours after. Your prostate tissue is temporarily in a state of increased blood flow and slight inflammation following sexual activity. Alcohol compounds this inflammation significantly. Research shows that alcohol consumed within this window can increase prostatic inflammation by 20 to 30% compared to baseline. Over months and years, this repeated inflammatory insult accumulates. Number 3, heavy physical exertion immediately after. The pelvic floor muscles and prostate have just experienced significant activity. Jumping into heavy lifting, intense exercise, or prolonged standing puts additional strain on tissue that's temporarily fatigued. This can contribute to chronic pelvic floor dysfunction over time, especially in men over 60 whose tissue recovery is naturally slower. Number 4, taking a very hot shower right away. Excessive heat to the pelvic region immediately following sexual activity can worsen temporary tissue swelling. The prostate is already experiencing increased blood flow. Adding external heat can push this into excessive congestion. Some men report discomfort or difficulty urinating if they take very hot baths or showers within 30 minutes after sex. Number 5, ignoring the need to urinate. Many men feel the urge to urinate after sex, but delay because they're tired or comfortable. After 60, the prostate is typically somewhat enlarged. Any urine sitting in the bladder presses on prostate tissue that's temporarily swollen from recent activity. This combination increases risk of urinary retention issues and can contribute to recurring bladder infections. Number 6, eating a heavy meal immediately. Digestion draws significant blood flow to the gut. Your pelvic region has just experienced intense vascular activity and needs adequate circulation for recovery. Eating heavily right after sex redirects blood away from the area when it most needs oxygenated blood for tissue repair. This won't cause immediate problems, but repeated patterns can slow healing of any minor tissue stress. Number 7, the biggest mistake. Assuming recovery time doesn't matter. At 30 or 40, you could do basically anything after sex with no consequence. After 60, tissue recovery takes longer. Prostate tissue needs time to return to baseline inflammation levels. Blood vessels need time to return to normal dilation. Pelvic muscles need recovery periods. Ignoring this by immediately stressing the system through any of the factors I've mentioned creates cumulative wear. Number 8, what you should do instead. The ideal post-sex routine after 60 is straightforward. Basic cleanup within 10 to 15 minutes. Empty bladder if needed. Drink water rather than alcohol. Avoid heat or intense exertion for 30 to 60 minutes. And allow your body a basic recovery period before sleep. Nothing extreme, just acknowledgement that tissue needs brief recovery time that increases with age. Now, about that natural protection. Mentioned earlier, some men are using specific compounds that research suggests help support faster tissue recovery and maintain healthy inflammation response, particularly in prostate tissue after it experiences the natural stress of sexual activity. These approaches focus on supporting the body's repair mechanisms rather than preventing normal activity. If you want to learn more about what's being researched regarding natural support for prostate tissue recovery and healthy inflammatory response, I've left detailed information in the description. This is educational content only. Always consult your healthcare provider regarding your specific health situation. Have you noticed any of these factors affecting how you feel afterward? What patterns have you observed? Share in the comments. Your experience helps other men recognize these considerations are normal after 60. The link for additional information is in the description.